We are good, thank you. So whenever you decide to cut out pieces of something, just know that every principle has its purpose in a treatment package, right? So when you start saying, well, I'm going to do this and not that, you're also cutting out the purpose of that component, right? So in an intensive toilet training plan, the one that I tend to use involves environmental manipulation. I'm going to explain all this in detail, which means we're going to set up the toilet training environment very specifically, right? The bathroom environment. It's going to involve a schedule. So we are going to take the child on, to the toilet on a schedule. That schedule piece teaches the routine. It is the only thing it teaches is the routine of toilet training. Here's how we do it. We stand up, we lower our pants, we go to the toilet, we sit, we urinate, we get a reinforcer. Right? It teaches the routine. Positive reinforcement, good job going to bed. Here's a whatever, and I'm going to describe this more in detail how to use it. But what's the purpose of positive reinforcement? To make it happen again and again and again and again. Right? Communication training. Some individuals are not going to need so much communication training because they're natural requesters, like they'll request to go. Other individuals are going to need a much more intensive communication training piece because on their own, they're not going to request when they have to go to the bathroom. So that's going to be dependent on the individual that you're training, whether or not you need a strong communication training piece or if they're natural requesters and it's just going to kind of happen very naturally for them. Forward prompting error correction procedure. Once again, I'm going to go through every one of these separately in detail. That's how we're going to handle the accidents. I'll say from the beginning, you cannot toilet train without accidents. You must have accidents in order to train. Accidents are the only piece of the procedure that actually gets the individual to know when they're supposed to be using the bathroom. You're supposed to be using the bathroom right before having an accident. That's when you would initiate, right? So you can't toilet train if you're not having accidents. And then prompting, graduated guidance. Graduated guidance is a prompting procedure where we teach individuals how to be independent, right? How to do things for themselves, how to lower your pants yourself, how to get up on the toilet yourself, how to wipe after you go, how to stand up, how to flush, right? All the physical components. Now, the type of graduated guidance you're going to need is going to be very dependent on the individual that's being trained, right? How much prompting are they going to need? How much assistance do they need? So that's a very individualized component. But before we start, we need to figure out if you're ready to start, right? So what are the prerequisite skills for urination training? One, the ability to sit on a toilet for about 3 minutes, right? If the child is constantly standing up, refusing to sit, or refusing to sit with pants off, right? Wants the pants back on, wants to stand up, very hard to train because you'll be fighting over that piece of it and not concentrating on the actual urination piece. So if you don't have that component, pretty simple. You just need to do sitting training. You put toilet training on hold, you do sitting training on the toilet. So just have a timer, have them sit without pants on, start with maybe 15 seconds, reinforcer, move up to 20 seconds, move up to 30 seconds, move up to 45 seconds, until you have about 3 minutes of independent, compliant sitting on the toilet. Second, the ability to inhibit urine for about an hour. Now, they're not yet toilet trained, so it's not purposeful. But in other words, the bladder is strong enough to hold urine for about an hour before releasing. So remember I said before, an infant is going to reflexively void over 20 times per day, right? That's going to be difficult to train if the bladder is still that immature, right? So you have to have a strong bladder. Now, I have trained individuals who don't meet an hour. I've successfully trained individuals at about 45 minutes, where their urine, without training, the urine naturally released about every 45 minutes. I tried training children at about a half hour, and it was not successful. I was not successful anyway. That doesn't mean that you shouldn't try. But I was not successful having children that reflexively void urine about every half hour. What we had to do was bladder training first. We put toilet training on hold. We did bladder training and then came back to toilet training after we got a stronger bladder. I'm going to talk about that in a second. Mastered some basic self-help skills. Not 100% necessary. Things like taking down your pants yourself, getting on the toilet yourself, flushing yourself, not 100% necessary, but it makes the toilet training job easier for the trainer, right? It's easier for the parent. It's easier for the teachers if there's a little bit of self-help skills that are already there. So if you can try to build in some self-help skills before toilet training, it's just easier. Right? Awareness of reinforcement contingencies. So in order to train, you're going to be using reinforcement. An individual has to understand reinforcement contingencies. I'm going to be told to do something. I have to try to do something. And then if it's right, I'm going to get a reinforcer. I'm going to get something good. Right? Toilet training is not going to be a lot of trials. So it only happens a couple of times per training session. So it's better if the individual already knows that. So if the child already knows, that's why we do things like verbal imitation programs in ABA, like clap your hands, they clap their hands. Good job, you're clapping your hands. The purpose of that program is to teach the learning principle. I'm going to tell you to do something. You're going to try to do something. And if it's correct, you're going to get verbal praise, right? And if it's not correct, no big deal. I'll show you what's correct, and then I'm going to ask you again. And then you're going to keep doing it until you get the correct response, right? So toilet training is going to use the same principles, but it's necessary for the individual to already know that. So like when I have kids come into a preschool at the age of 3, right? Like let's say they have a diagnosis of autism. They come in at the age of 3, and I say to the parent, "What do you want done?" One of the first things the parent says, "I want toilet training done." And I say, "Okay, we're gonna hold off on that probably until they're 4. We're gonna wait until next year for that." I said, "Well, why would you wait till next year?" Because I want them to learn how to learn first, and then the toilet training is going to be so much simpler and so much quicker if they already know how to learn from their environment. So we're going to take a year to learn from their environment, and then we're going to move on. Yes.
So I have holders, like they freak out, they say, and will hold. Is that something that like I would need to do? So if they're holding, is that something that I should start with the just sitting training?
Yeah. So holding is actually a problem, right? It's a big problem, and we tend to call them low frequency urinators. It's hard to toilet train a low frequency urinator because what happens is they hold it and then you have very few trials to reinforce, right? And if you miss it, you have no trial to reinforce because you missed the one time they're going to go per day. You missed it. So what I typically start doing, reinforce urination as a response, even in a diaper. So in other words, I don't know if your children are in diapers, but if they are, if they urinate in the diaper, you actually do a diaper check. You go, "Good job, you peed in your diaper. Good, you peed." Just go. And because whatever you reinforce is going to increase in responding, right? So I would probably increase liquid intake. I would probably increase liquid intake and reinforce urinating as a response, not with toilet training, just as a response. Urinate more, urinate more, urinate more. Reinforce, like whatever they really love, whatever reward they really love, hold it. Don't give it. So let's say they love iPads, right? They love the iPad. Well, they don't get the iPad in the day, right? They get the iPad for 15 minutes every pee. But not in a toilet, in a diaper. So there's you pee in a diaper, you get your iPad 15 minutes. Just to increase that response, and then shift it. Yeah, then shift it into actual toilet training.
All right, thanks.
Yep.
The sitting for approximately 3 minutes, is that sitting without any activity? Like
no activity. So we never want to. I usually put this in the bowel training piece because we sit for a little bit longer then. but you never want to have fun on the toilet. So no reading, singing, music, anything on the toilet. And the reason why is it sets up the wrong contingency, right? If the child is having too much fun and too much one-to-one interaction with you, singing and doing iPads on the toilet, then the only thing that's going to stop that from happening is urinating, right? So what's going to happen is I'm sitting on the toilet, I'm having fun. I pee, mom says, good job peeing. Come on, fun's done. Off the toilet, we're going to go. Mom goes back to something else. I get put over here. What happened to the fun? It's actually in my best interest to not urinate, right? So we don't have fun on the toilet. We have fun off the toilet, right? If you urinate, I'm going to have a lot of fun. But while we're sitting on the toilet, your only job is to pee or have a bowel movement. So it's 3 minutes, nothing. Yeah, which is hard. 3 minutes is long. 3 minutes is long, and you'll see you might not have to do 3 minutes. If he or she is a quick urinator, then you don't have to do 3 minutes because you actually get off the toilet as soon as you urinate. Yeah. And low rate maladaptive behavior. So things like aggression, self-injury, non-compliance. I mean, it would be great if you have like no problem behaviors. That's unlikely to happen. But the purpose of this is you can't be trying to toilet train when you're spending too much time dealing with self-injury or aggression or screaming or stereotypy. If that's the focus of your time in the bathroom, then you're focused in the wrong contingency. So what I do here sometimes when I have a kid, sometimes it just hits me off guard. So I start to toilet train and I say, okay, you know what? We're spending way too much time dealing with his aggression right now. So I need to put this on hold. We need to put a behavior plan in for aggression. Then I'm going to come back to toilet training when that's not the biggest focus, right? So you might have to put things a little bit on hold for that. Notice here, there's nothing about the child knowing that they're wet, nothing about the child telling you they have to go, nothing about the child trying to change themselves, right? None of that is actually a prerequisite for toilet training. Right? Even though you'll be told that sometimes, that the child will let you know when they're ready. It's actually not a prerequisite. But let's say you have an issue with the bladder strength, right? So you're not meeting that 1 hour between urinations, right? It's the bladder is very weak, the urine keeps flowing out, it happens very reflexively, it happens more than once an hour. If the child is very young, I just say wait, right? So if you have a child that's under 3, I would say to wait till bladder to mature. If you have a child that has a significant developmental disability, has fine motor, a lot of fine motor difficulties, a lot of low muscle tone difficulties in other areas, I might even say to wait if the child is 4. Possibly I might say to wait if the child is 5, right? Just to see if the bladder will strengthen on its own with age and with use, if it'll just start to strengthen on its own. Once we're at 5, now I'm thinking it's not going to strengthen on its own. So we're going to need to step in and do some actual bladder strengthening exercises. It's really just a muscle, right? The sphincter muscle of the bladder is really just a muscle, and it needs to just work out. It needs to be strong enough to hold the urine, right? So there are exercises to do that. They're not so easy, right? They're not so easy to prompt because here's the problem. It involves a child being able to internalize their own feelings, right? So they're strengthening a muscle that no one can see, right? And therein lies a lot of the prompting problem. Right? I can make them do exercises of a muscle that I can see the movement, but when I can't see the movement, they need to strengthen by tightening and releasing and tightening and releasing a muscle that I can't prompt. They have to do it themselves. That's really difficult, right? But there are some ways. One way is called double voiding, right? The problem with double voiding is if you're not already toilet trained, it's a little bit of a problem. Double voiding is when you tell a child to go to the bathroom and they urinate, right? And then after they urinate, you make them push out more. You say, okay, you already peed, but now you got to push out more pee. You got to fill up a little more of this cup. You got to push out more pee. right? And you make them pee even more. What are they doing? They're making that muscle open again, even though the muscle's already closed, right? And they're using that bladder muscle to push out more pee. Right? There are Kegel exercises, right? They're pelvic muscle contraction exercises that were originally developed actually for women to re-strengthen lower urinary tract muscles, to re-strengthen them. They have been developed now for men as well. And they're also now used for children who never developed the bladder muscle. You can go on YouTube, you can go online, look up how to do Kegel exercises. They're physical. The good thing about it is you can prompt it to a point, but there has to be a point where they're actually contracting their own pelvic floor muscles. Not easy to teach an individual to do, right? But it is possible. And there is research showing that you can do it with children with developmental disabilities, and you can do it with children with physical developmental issues as well. So you can look up those articles. Repeated interruption of the urine stream is what I tend to use. And once again, it's a little bit of a problem because the kid has to be a little bit already partially trained, at least trained enough to play a game with you where they will urinate. It doesn't have to be on a toilet. You can make them just urinate just outside in the backyard or something like that. But whenever you see them urinating, you play a game where, this is going to sound kind of gross, but they have to stop the urine stream, start it, stop it, start it, stop it, start it. One way you could get them to sometimes do that is put their hand in the urine stream and then get them to say, stop peeing before your hand goes in. They have to, they stop peeing and then, okay, start peeing, stop peeing, start peeing. What are they doing? They're working out that muscle. Now, the only contradictory part is here. If a child is completely untrained, they're not going to maybe follow the direction of stop peeing, start peeing, stop peeing, start peeing, because they're untrained, right? This is one that you could possibly also do, is holding during the day. If you have a child that has overnight toilet training issues, one of the problems is they're probably going too much during the day and the muscle is never strengthening. So if you have a child that's urinating the bed overnight, what you need to do first is reduce their amount of urination in the day by about half, right? By when they start to go, say, no, you have to wait. No pee, you have to wait, right? And make them not pee during the day. So it's almost the opposite of what you think, right? You sometimes think that you would make them go more during the day so they don't go at night. It's the opposite. You actually want them to pee about half as much during the day so that the bladder is strong enough to maintain overnight. Okay. Let's get into the actual training component, right? So the more intense you train, the quicker this will be. You could actually toilet train somebody. You could toilet train Nathan Azrin, who was a big toilet trainer in behavior analysis, he has a book called Toilet Training in Less Than a Day. It's for neurotypical children, toilet training less than a day. The procedures are the same. And we know that in research, we know that even children with pretty severe developmental issues and physical issues, you can still toilet train within a weekend. Or at least within about 2 weeks, right? So I typically tell parents, you're in for about 2 weeks of a really intensive toilet training program, potentially more. Like, I'm not going to hide it. You might be you might have to go 3 weeks. You might have to go 4 weeks, right? You might be able to get this done in 3 days. It depends on the intensity of your training, and largely it depends on the child and how long they're going to take to understand the contingency. But the more intense you do it, the quicker it'll likely be, right? So we're going to prepare the environment. I'm going to describe the most intensive training procedure, and then you can do whatever you have to do in your environment. I recommend toilet training fully in the bathroom, right? So right in the bathroom, toilet training for at least 4 to 8 hours per day. Right? Depends on if a school's going to maybe help you out. So if you get a school to help you out, that's the best case scenario, is that your child's school says, okay, we're in for this too. We'll toilet train in the day, and you guys toilet train in the afternoon when he or she gets home, right? And so I used to have a school that used to be partner very well with me, and the kids used to come into school, they go right to the bathroom, right? In the morning, they stay in the bathroom all day long. They don't leave the bathroom. They eat lunch either in the bathroom or they eat lunch directly outside the bathroom, right? Now, if you're in a home, right, oftentimes home bathrooms are kind of small. It's hard to stay in there for so many hours. What I typically recommend is toilet training in the room that's adjacent to the bathroom, but not leaving that room. So whatever room is next to the bathroom is where you'll be spending your whole day and not leaving that one room, right? And you'll see why when I get to the accident correction piece, you need to be right by the bathroom.
Why not take, like, for the younger children, a potty with? Is it really necessary to stay at the bathroom, or could you swap the situation by just taking a potty wherever you go?
Yep. So the problem with the potty seats are they add a second layer of potential fading off the plan that is sometimes problematic. Especially I've encountered it with autism spectrum, that once I've trained to the potty seat, let's say in the living room or and then we'll bring it up to the bedroom at night, and then we'll bring it up to, I can't sometimes get them to unlearn that contingency of I could just go wherever. I can't generalize it back to the toilet. And I find that it just adds an extra training layer that didn't have to be there. If I just trained to the actual toilet, I don't have to untrain going to the bathroom in a potty wherever I move the potty seat. Now, if you have a child that's not gonna, you know from the start, that's not gonna be a problem. Like whatever we start, they give up very easily once I reintroduce something else. I don't see that being a problem, right? But if you have a kid that you know, once I train, they get stuck. Like this is the way they do it. And it's very hard to retrain into something else. I would avoid the potty seat. Yeah. So in the bathroom that you're going to be staying or in the room, they're not sitting on the toilet the whole time. They're only on the toilet actually very short amount of time, but they're in the bathroom environment for a long time. So what we do is we bring in chairs, right? You need a couple chairs in there, one for you, because you'll be in there for hours as well, unless you rotate with other people, but you'll be in there for a long time. So you need a couple chairs, that way he can sit, you can sit. You need things to do, right? It's just boring. So you need activities, right? If you're doing it in the school, there's no reason why they can't be doing learning activities. You just bring everything in, like whatever they do in the classroom, they're now doing in the bathroom on a chair. But they're at least, close to the bathroom. People say, oh, speech therapy. You can do speech. I've had speech therapists come, they do it in the bathroom. The only discipline that's a problem tends to be physical therapy. Physical therapy in the bathroom is a problem because by the nature of the therapy, they can't do it in the bathroom space.
Is the idea that you're just like, it's the constant exposure? Like, what is the idea of having a bathroom like that?
So we're gonna have to, one, it's the constant exposure, but really more than anything, it's gonna be the accident correction piece. And I'm gonna explain the accident correction piece in a second. Right? You're gonna be prepared with reinforcers, right? You need to be prepared with time. You need a timer, you need an electronic timer. You need drinks. We're gonna be flooding up with liquid, so you need a lot of drinks, right? So you gotta get everything prepared. You'll be spending a long time in the bathroom. These are just, these are not mine. These are just taken off of like Google Images, but this is what it kind of looks like. If you have a young kid, you also want a ring around the toilet seat, right? In order to make sure that it's a little bit smaller so that they can keep themselves without falling in. Because you need to be relaxed in order to urinate, right? So in order to get the muscle to really work the way it's supposed to work, you need to be in a relaxed state physically, right? You can't be tightened up. If you're too tightened up, the urine doesn't flow easily, right? So you need to small ring, and also the step stool is very important, not just for getting up, but for having the feet put on the floor. Because same thing with the dangling legs, it makes the bladder muscle not as easily able to release, right? Everything stays too tight, right? So you're gonna want to keep a step stool for the child. So you got to also prepare the learner. I recommend that this can be for the accident correction piece too, limited clothing. So a toilet training, like a typical toilet training uniform is a t-shirt, underwear, and socks. That's it. T-shirt, underwear, and socks. You can't really, and the t-shirt has to be above waist level, right? You have to be able to see the underwear. So t-shirt has to be above waist level. The underwear that I recommend is regular brief underwear, like regular men's brief type underwear. That's going to be on like a little bit on the tight side. And the reason why is you need to see the accident. So the best color underwear is actually going to be light gray or like a red or like a light blue are going to be perfect colored underwear to see the urine start to flow. White's a little bit problematic. Things like black is very problematic, right? You can't toilet train in jeans. You can't toilet train in summer shorts. The urine just flows right down the leg. You'll never see it. You can't toilet train in dresses. You'll never see the urine. So you have to toilet train in underwear. If you're in an environment where you can't use just underwear, then your next best alternative is to use like leggings, like even in a boy, right? So to use like tight, light gray leggings, so that everything will be tight. So when the urine starts to flow, the leggings start to get wet right away. Right? Prepare to increase liquid intake. We're not going to force liquids, but we're just going to make it freely available. There is some disorders go along with insatiable drinking. You have to just watch out for that, because if you're going to give free flowing drinking, too much liquid intake in too short a span of time for a certain body weight can throw off electrolytes, right? And it could just be water. We're not talking like Gatorade, just like regular water can throw off electrolytes. It's called water intoxication, right? It's typically not that dangerous, except for the fact that it can lead to things like seizures, which is problematic. But so I'm just throwing that out there, that if you have a child that you know is going to insatiably drink one after the other, you just want to make sure you're monitoring the liquid intake as much as you need to, right? But typically what I'm recommending is just like a few more juice boxes than normal, or a few more water bottles than normal, not like a tremendous amount of liquid. You just need enough so that the urine starts to flow. And you're going to choose one highly preferred reinforcer. It's something the child really likes. And the thing is, you need to remove that from the rest of their day. So choose wisely. Whatever you're going to use for toilet training, you can't use for other things for at least the period of time that you use doing the training. Half-hour schedule is what I recommend. So every half hour, you take the child from their seat or wherever they're standing to the toilet, which is right there, right? And you're going to take them every half hour. There's no reason to ever go below a half hour, because you need to have accidents. You never want to avoid accidents, right? So we're going to keep to a half-hour schedule, right? Where the child's going to go every half hour. You're going to prompt them to sit on the toilet. On the toilet, they're going to sit for about 1 to 3 minutes, no more than 3 minutes, right? The reason why we cap it at 3 minutes, even if you know the child has to go, we cap it at 3 minutes, is because urination is an active, not a passive response. You make yourself urinate. Like you don't just like start to let the urine flow, right? You actively make yourself urinate. So we cap it at 3 minutes. That way the child learns, oh, I'm not just sitting on the toilet and something happens. I'm sitting on the toilet and I have to make something happen. And I only have a certain amount of time to do it to get my reward, right? So we cap it about 3 minutes. If the child urinates in that 3 minutes, we give a lot of verbal praise and we give the reward. When do I tend to give the reward? Whenever you give the reward, it's up to you, but I tend to give it after I remove the child. So they urinate, they finish urinating, I tell them to stand up, or I just prompt it, right? I prompt them to raise their pants, and right there, I give the reinforcer, right after raising the pants. The reason why I don't do washing hands. Washing hands is going to be a problem. Don't do wiping. Wiping is going to be a problem, right? Because anything that gets in that contingency is going to fuzzy up the contingency of you sit, you urinate, you get a reward, right? Because otherwise it becomes you sit, you urinate, I try to wipe you. It takes long. You don't actually like it. You're now trying to stand up. I'm continuing to wipe it. Then I flush the toilet. And now I give you a reward. Well, the urination was so far back in this whole chain. Once you do hand washing, forget it. Who knows what you're rewarding at that point? Once you're hand washing and then the reward comes. So you want to do the reward as close as possible to the urination. Right there. If you have a child that's going to need a request component, not a natural requester, right? You're going to build in the request to the 30-minute schedule. Right before you take on the 30 minutes, right? You prompt some form of a communication response. And whatever that communication is going to be dependent on you. I would talk to the speech therapist if you have one, or you know your child and how they communicate. Like, however is going to be the easiest for them to let you know they have to go to the bathroom. That's what you prompt right before you take on the half-hour schedule. Right? You don't reward it. You don't do anything. You just prompt it, right? And then take them. So I typically do. I give a natural response. So let's say I'm using a picture exchange. Let's say I have a kid that's nonverbal and he's going to use some sort of a talking device or a picture exchange thing. What I do is right before the half-hour schedule, right before I'm going to take him, I take his or her hand. I don't say anything. I take his or her hand. I touch the device. The device says whatever the device says, bathroom, please. Then I give a natural response. I say, oh, you have to go to the bathroom? Thanks for telling me, come on. And then I take on the half-hour schedule, right? So I act as if it was independent, even though I prompted it. Do not do anything like ask, do you have to go to the bathroom? Don't say, touch your picture. Don't say, okay, tell me you have to go to the bathroom. None of that. Just prompt it and then say back natural. Oh, you have to go? Thanks for telling me, come on. And then just go. But you could use a verbal response. You could use sign language. Then you would just prompt the sign right before, right? You could use anything. You could be creative, right? I had a kid once that I was on a respite trip with, actually, and I was the first time I was meeting him. And the mother had, now thinking back, wasn't the safest thing. It was the first time I was meeting him. And I took him on an 8-hour respite trip to a beach. But the mother dropped him off and we had like a safety sheet, and she was telling me all the things I would have to know about her son. He was like a teenager, and all the things I would have to know about her son before I took him on the trip. And so she was listing it all out. One of the things she said he has a wristband on, like a sweatband, and it's the only communication he has. She goes, so he's not going to communicate to you at all, none, no sign language, no pictures, no pointing, no anything. He's not going to do anything. But if he ever takes off the sweatband and holds it up, that means he has to go to the bathroom. He's toilet trained. He's not in a diaper. It's the only communication he has. He takes the sweatband, he holds it up. That's what he does. That's the only thing he will communicate to you all day. I partially believed it was going to be accurate because I just never heard of it. It was very unique to me, right? And I'm thinking, well, he doesn't communicate anything. And then, so I was partially thinking 100% accurate. I got back that day and I said, who taught him that? I was like, I need to know who taught him that. It wasn't a behavior analyst. It was a special ed teacher that he had way back. And I said that, I was like, unbelievable that she thought of that. He was able to do the motion. He was able to, because he had physical issues as well. He was able to do the motion and it was 100% reliable. He was dry. He would hold. I would right away get him to a bathroom and full urine stream. And then I would put the mother told me I had to put the band back on. He couldn't put it back on. So be creative. You can really just use whatever communication is going to work for you. And then the accident correction piece. You cannot toilet train without accidents. If you toilet train without accidents, schedule only. And I hear a lot of programs tell me this. I say, what do you do? Well, we take them on a half-hour, 20-minute schedule. So, okay, great. What do you do? We reward when he goes. Great. Perfect. What do you do with the accident? Well, we just change him because we don't want him to feel bad about himself, and we don't believe in punishment. So we just change the accident and we just ignore it. And we just keep taking him on a schedule. Too many accidents will reduce the schedule down to 10 minutes so that we avoid all accidents. The problem with that is all you're going to get is a scheduled, I'm generalizing, but typically all you're going to get with that training plan is a scheduled trained individual. They will hold and go when you take them, but they're not going to initiate, right? Because the only thing that hooks bladder tension up with initiating, that's when you initiate, right? When you feel bladder tension, right? You initiate a trip to the bathroom. When you start to feel that bladder tension, you initiate the trip, right? The only thing that tells an individual that they have bladder tension is the fact that they're about to have an accident. That's the only cue to the outside world that there was bladder tension there, is the start of the accident. So we need accidents, which is why I never go below a half-hour schedule, right? In fact, if I'm not getting accidents from day one of training, if there's no accidents, I bump the schedule up to 45 minutes or an hour in order to get accidents, right? Or I increase liquid intake to get the accidents, right? So there's a couple of things you can do with accidents. You'll see a lot of toilet training programs if you go online or get a book. They'll use a punishment-based component. So they'll punish an accident, right? It's effective. It's not necessary, but it is effective. The procedure that I use is not a punishment-based procedure. I use what's called a forward prompting procedure, right? So child's in the bathroom, child's being flooded up with liquids, child's on a half-hour schedule, right? But I'm flooding him up enough that he's going to still have to go, right? So I'm watching and I'm watching and I'm watching, and I'm constantly watching the kids' underwear, right? I was, if you can't, they can't be under a desk. Boys are easy. Young boys are easy. Young boys are going to urinate from the front, right? So a young boy is going to urinate out front, right? And the wet spot on the underwear is going to come right from out front, really easy. A girl is harder because a girl's going to urinate from underneath. So if she's sitting down, you're going to start to see urine come out before you notice the underwear wet. Oftentimes what you notice is a little urine starting to come out on the seat because the girl's going to urinate from underneath. An older boy, same thing, might urinate a little bit from underneath depending on how large the penis is going to possibly urinate down, not out. But you're watching and you're watching and you're watching and you're watching. And as soon as you see urine start to flow, at the very beginning, we give a startle response, right? We startle the child, not in a bad way. We don't do, you're not angry, you're not disappointed, you're not angry. It's not anything like that, but it's a hurry up, here it is. Like that. It's like excited is maybe the better word. It's an excited startle. Like it's like what you've been waiting for all day. It's like, here it is, it's happening. Let's go. Like that. You right away pull the kid up, right? You're not angry, you're not, it's not a punishment, but you're like, quick. Why are you doing that? To startle them a little bit. When you startle them, the bladder muscle automatically tightens, right? That's just evolutionarily built into us, right? So you startle, the muscle tightens, you have a couple of seconds before it's going to flow again, right? Before the child realizes, oh, wait a minute, there's nothing startling here, like that. And then they relax and then the urinal flow. You got a couple of seconds, you take them from wherever they are, you rush them to the toilet, which is right there. It's like right, either you're in the next room over or you're right in the bathroom, right? No time for communication. You just get them right on the toilet. You lift them up, put them on, right? Or, you hurry up if they're low, if they're bigger and older, you don't lift them, but you right away get them onto the toilet and then you immediately calm down. You go, okay, now pee, and then you'll get whatever, soft voice, calm voice, right? 1 to 3 minutes, they get to stay on that toilet, right? If the urine starts again, we're going to do a full reward as if it didn't start as an accident. We're going to do full, good job, you held it. And then you peed on the toilet. Good job, you held it all the way from over there. And then you peed. And the perfect thing about that is that bladder tension started it. It wasn't a timer, it wasn't a schedule. It was bladder tension followed by holding, which you created because of the startle, but it doesn't matter that bladder tension followed by holding, followed by finding a toilet, followed by peeing, followed by reward. That's exactly what you want, right? And the way you got that was by using the accident as the start. Now, if you miss the accident, it's going to happen. Yeah, you're in there all day. You're waiting. You turn around to tie your shoe. You stand up. He's in a puddle on the floor. Done. No big deal. But at that point, I recommend just changing. You missed the teaching trial. You don't punish. You don't whatever. You just okay. You're wet. We'll try again later. Then you just change, right? You missed the teaching trial, right? They do make alarms that you can put in pants to do that. I don't typically use the alarm because once again, I feel like it adds a layer that doesn't need to be there. If I can get a one-to-one trainer just to watch the kid, your job for the next 3 hours is to watch his urination, right? The alarm adds this extra added piece of, did I put the alarm in? Did I put it in right? Why didn't the alarm work? Now the child's hearing an alarm, but they do make them. And a lot of toilet trainers will use alarm underwear in order to signal that. And if you do use the alarm, use it the same exact way. The alarm starts to go off, signals that the underwear is getting wet. You go, hurry up, it's happening, like that. And then you bring it, you do it the same exact way, but you have the alarm to help you out instead of staring at the kid's underwear. Okay. Oh, by the way, if they don't restart again, no big deal. I just say, okay, I guess you don't have to go anymore. And then I take them off the toilet. That'll happen every now and then. They start as an accident, they hold, they get to the toilet, nothing. 3 minutes. I say, okay, guess you don't have to go anymore. But here's the thing, you know they do, right? So now you're going to be watching very closely. Right? I take data, frequency of accidents, percent of urination on schedule, independent requests. That's the data sheet I tend to use. I can't really say it. I don't mind giving these slides, by the way. I don't know if you guys have them. You could turn them into a handout or something and just, I don't know, send them off to people. Doesn't matter. Or send them off like this. Some people would rather it PDF'd or something, but you can do, because you have it, right? Yeah, so you could do whatever you want with these slides and give them out to people. They could even grab the data sheets from it probably, because that's an image. Then I fade it out. I fade out the plan, fade out the intensity of it. I typically don't change anything for 2 weeks. When someone tells me, well, when do I change the plan? Typically I say, if the kid's not getting hurt, like there's no reason to believe you're doing any harm to the kid, keep going for 2 weeks without making any change. Just be positive and go for 2 weeks without making change, right? After 2 weeks, if you're not getting any progress whatsoever, you're not getting any independent requests, you're not getting any holding, you're still having a ton of accidents after 2 weeks, then it might be time to say, what's going wrong here? What do I need to tweak? Maybe I need to change the schedule. Maybe I need to change the reinforcer. The reinforcer, by the way, is what I usually go for first. I say, change the reinforcer. I say, what are you using? Oh, we're using the iPad. And then I talk to the parents, I say, but you also, he has the iPad right now. Like, why is he on the iPad? You're in my office. Like, why is he on the iPad? Well, I also give him the iPad when we go out. Okay. Oh, and I also give him the iPad when he goes to sleep. Okay. And I also give him the iPad when he eats. Okay. I was like, you can't use that for toilet training then. He has the iPad all the time, right? You need to be, so usually my reinforcer is the first change. I say, you know what? We need to change the reinforcer. You need to maybe no iPad at all, unless he urinates. The other things I'll change is the schedule. I change a lot of times. I'll change the schedule. I'll say let's make the schedule maybe 45 minutes, get more accidents. But 2 weeks I don't make any change in a plan, right? And then I once again fade it out. 10:30, right? Okay, perfect. Any urination? This is quick. I mean, oftentimes I'll do this for like a 3-hour talk, or something like that, to really. But it's just introducing you to the topic of it. Have you had any questions about urination training? Oh, we got a question. No. Yes. No. Yes.
So it's actually not related to my 11-year kid. But my oldest daughter, she tends to push a little bit when she pees. So I wonder if I did something wrong, that she cannot just let it flow without pushing a little bit for the pee.
I don't know. I wouldn't say that you did anything wrong. Why she would be pushing. My first thing would be medical. So my first thing would be go to a like a urologist, or go to maybe just even the pediatrician. But I would first go to a medical professional and just describe that. Say she doesn't seem to be able to pee without pushing, and it doesn't seem natural. And see maybe what he or she says about that. Is it a problem? Is it like is there not enough urine flow?
No, I don't think so. And I tell her, just let it flow, don't push. And she said, but it's only coming out when I do that.
Is the urine flow very thin?
Yeah, it's not that big.
It's not that big. And is there enough content? Is there enough liquid come out? Like if you had to measure it, is it enough liquid?
I don't know. I would try to increase maybe to see if it's like really flowing.
Yeah, I mean, I'm not a medical professional. That sounds to me less like a toilet training problem, because it seems like trained, right? But for whatever reason, she feels she has to push to let it out. And I don't know why that would be.
I gotta check.
Yeah, I would check that. Or when it comes down to it, if it's not a problem, then it's just not a problem. Yeah.
We don't have the problem during the day that she realizes when she has to go to the toilet, but she doesn't realize when her bladder really is empty. So she starts to stand up before that, and she often, maybe she even holds like half of the urine back in, and just stands up and goes everywhere. And when has to go to the toilet half an hour later or 10 minutes later.
Yep.
again.
And then are there accidents or not accidents? She'll go back to the toilet. Okay. So one thing you could try is reinforcement of amount, right? So I've done it one of two ways. I had a child who would have very short urine streams, right? Very short urine streams. So what I did was had a timer, right? And the target behavior was the urine stream had to be for a certain amount of time, right? So once he started peeing, actually it was a girl. Once she started peeing, she would have to pee. The urine would start to flow. I would set the timer, and I told her what number. So I was like, you have to get to, I'm making this up now because I don't remember the detail. I was like, you have to get to 7. If you don't get to 7, you don't get your reward. You have to get to 7. You have to keep peeing till 7, right? And I allowed her to start and stop. And I was like, you have to keep peeing till 7, right? And if you're not still peeing, no reward. She was already trained. So it was trained. And then I, through reinforcement, increased the urine stream, right? Another way you can do it is by amount, right? So you can have a cup with a line and then say you have to pee up until the line. If you don't pee up until the line, you don't get a reward. And that reward has to be something that is really wanted. Of course, I mean, I would say you've probably already done it, a medical, right? To say, is there a physiological reason why she cannot empty this bladder? And if there's not medical, then it leads it to be behavioral, and then that can be shaped in that way. I would try that. I would try urination of the urine stream, length by number, or, and you don't have to, she doesn't identify numbers. That's okay. You could do claps. You could go, okay, I'm going to clap, and I'm going to clap, 5 times. But if mom's not finished clapping, you have to keep peeing until the clapping stops, right? You have to be a little creative maybe in how you're going to get that concept of length. Or like I said, fill the cup sort of concept. They make urination measuring that you don't have to hold a cup. It actually is an insert on the seat, where when you pee, the kid's just peeing naturally. You're not holding a cup, but there's lines on a thing, and it goes up to the line. That you could maybe try that. They actually make, for boys, I know they make urine stream sensors where it actually like plays songs while they urinate. And so, yeah, so you could have it like, Yeah, and you could do like, you have to pee for the whole song. You know, you have to pee until this word, you have to pee until it's not words, it's usually like a melody songs.
That's what we did, but then you said, don't give her the iPad while she's peeing. What do we do then?
No. When I'm saying not
I know, but we had the solution to give her, to put her on the toilet and say, okay, you get your iPad, but you have to pee, otherwise I'm going to take the iPad away.
Okay, so reinforcement always works better the other way around. So what you're doing is you're giving the reward on the promise of a behavior. Reinforcement always works better when the behavior precedes the reward. So you probably want to turn around that contingency. You pee first, then I'll give you the iPad. I'm not going to give you the iPad in a promise to pay. It's going to be the other way around. Yeah. Yes.
Hi, our daughter is 2 years and 3 months old, so she's still very young, but she's just starting to express interest in the potty because I think she's an older sister, so she's interested in it. But I don't think she can meet some of your prerequisites. Would you recommend that we slowly let her continue to play with the potty, or should we just kind of work on the prerequisites first and then go with the big bang of training?
How old?
2 years and 3 months.
And she's a girl?
A girl.
Okay, so girls, you're right around the right age, because girls are going to oftentimes start to, this is neurotypical research, but girls are going to typically start to train around 2 years old and finish at about 2.5. And boys, it's very common to start around 2.5 and finish around 3, right? So she's right of the age, actually. So if she's already started to show interest, what I would say to do, of course, I'm giving very generalized advice because I don't know any of your children, but I would say teach the prerequisites and start toilet training rather than have her potentially learn more inappropriate things with the potty. Because when you said, should I have her first just play with the potty? I would say you don't want her to play with the potty.
But like to be pulled off and letting her sit on the little potty and just bringing the requisites.
The problem is that you don't want to teach anything that you don't want taught, right? So if she starts to sit on the potty and she's now thinking of it as a play thing, right? I play, I sit, I watch TV on the potty, I stand up, I pretend like I'm doing stuff, whatever. That's all being taught. Now you're going to have to unteach that. Say, no, we don't play on the potty. We don't watch TV on the potty. We don't do that on the potty. We pee on the potty. But you've already taught. I sit and I watch TV on the potty and I whatever. So I would say prevent her from forming any inappropriate contingencies with the toilet. Get the prerequisites because she's of age anyway. So get the prerequisites and then toilet train.
Thank you.
That's what I'm thinking.
Right now, her move is we'll put her on the toilet. We'll try to do some encouraging and stuff like that. She'll eventually get off the toilet, walk into the living room and then pee all over the floor. Look at us like,
What was that? Yeah.
So I don't know if anything sort of we're doing.
We didn't do a big.
Yeah, I would say to train because I would say potentially she's even starting to hook it up. She just has it wrong. Like she just had, right, she has the contingency wrong. So she feels like she has to pee. She goes and she sits maybe on the potty, doesn't know what to really do, and then stands up. Maybe she is starting to you might have a quick training procedure if all you need to do is re-establish that in the right order. Yeah. Okay. 15 minutes. Okay, so bowel training. Right? And I can't judge online, but was anybody specifically here for the bowel training piece only? And like you didn't even really need the urination piece. A little bit, okay. So because I'm going to go through it very quickly, and then you could kind of hit me up afterwards if you want. But bowel training, typically you have to figure out why the child is not bowel. If they're already urine trained, you have to figure out why are they also not bowel trained? Like why didn't one happen with the other, right? So there's a little bit of an assessment piece. And what I tell parents to do is if you have a situation where you want to work on bowel training, you got to take about 3 weeks worth of baseline data first, where you write down where they went, what time they went, if they were a diaper or not. You have to write down the consistency of the stool, like hard, soft, very soft. You have to write down a little bit of the consistency of the stool, right? You take about 3 weeks worth of those data, because what we need to do is, unlike urine training, where I'm going to be able to pick the time, bowel training, I need to work on their time. And we only typically have 1 or 2 bowel movements per day to work with, right? So I take data for 3 weeks, and I always do a little scan of it myself. And if anything looks strange to me, I have it bounced to the pediatrician. And I say, okay, here's the deal. They're going like 5 times a day. That's not typical. That might be typical for your child. But before I start with a behavioral bowel training plan, I'm just telling you it's not typical. So we're going to run it past your pediatrician first. And he's going to look at the data, or she's going to look at the data and make a determination as to whether or not a behavioral bowel training plan is good right now, or should we maybe be doing something dietary, or maybe we should be doing something schedule wise, or maybe there's some type of supplement we might need in order to regulate the bowel movements first, regulate the stool, and then should I come in? Or is the pediatrician going to give me the green light to say, no, it's not typical, but it's typical for her, and you have the green light to try some behavioral bowel training procedures without any supplements or dietary change. So that's usually my first course of action, right? Then I decide what I'm dealing with. If it doesn't seem to be physiological, right? So is it a skill deficit? That's the easiest of the bunch. Skill deficit means they're just not trained. It's a toilet training plan. They did not generalize from urine to bowel training, right? So what I need to do is an actual toilet training plan, but just the target behavior is bowel movements and not urination, right? Or another one that I come up with very frequently, I'm going to jump around a little bit, is the ritualization and routine. These are kids that are trained for bowel training, but they will only go in a diaper after school, behind the couch, and then they're done by 3:30 and they want to be changed. And it's every day. Like this is what we, every day. In fact, he doesn't even wear the diaper. Sometimes they request. Like I've worked with plenty of kids who request the diaper in order to have a bowel movement. It's the routine, right? And I say to the family, you don't need toilet training. Your kid is trained, totally trained, not trained the way we would want socially appropriately, but they're completely trained. They hold, they wait, they ask, they get a diaper, they go behind the couch, they have a bowel movement, and then they wait to be changed. That's trained, right? What we need to do is we need to change that ritual, right? We need to take the ritual from their starting point, and we need to make it in the toilet, and we're going to work with them to slowly give up their routine. We're going to slowly fade out their routine. I'm not really advancing the slides because of time, but I have slides on this, but you can have access to them. But in other words, if they go behind the couch with the diaper after school, my first reinforcement step might be in a diaper after school behind the chair in the corner. So I take the couch, I push it to the wall, and I say, there's no more behind the couch. We've moved the couch. You can't have a bowel movement behind the couch. You could put on your diaper and you could go behind that chair. That's the new toilet for you, behind the chair. And it's not so bad. And you'll get the iPad as long as you do it. I'll still change you. I'll still, no fear here. You go behind that chair with your diaper, come out, I change you, you get the iPad. It's rewarded, but there's no more couch. What are we doing? We're breaking that routine slightly, right? Just slightly breaking the routine. We don't want to move too quickly, because what happens with bowel training is the arch enemy of bowel training is constipation. Like you cannot, once the kid gets constipated, your bowel training plan takes a turn for the worse. And then it becomes a problem, because then the kid eventually goes either on their own and it's painful, and they're like, you did this, like you messed up my thing. I was fine until you came into my life. And now I had this really painful experience. So I'm not doing anything you're telling me to do. Or even worse, it doesn't ever come out. And then you're dealing with enemas. And then you're dealing with surgeries, maybe not surgeries, but just like a medical flushing out of the bowels. Any way you look at it, it's going to be really hard for me to go back into that house and say, I'm back with your reward. The kid's like, no, this is not good. So the minute they see you, hold it, right? So we always want to go very slow with these plans, right? So that's what I'm saying. Someone says, I'm going to let him go behind the chair. Like I needed you as a professional to come to my house I'm going to reward him for going behind the chair. Yes, because it's not his couch. Like that's the only change, right? And it's easy enough that he's going to be likely to accept that change, right? And then make it different slowly. So, okay, you know what? You can go now, but you have to go in the diaper in the bathroom. But I don't care if you're in the shower. In fact, go in the shower, turn off the lights. It's like the couch. Like go in there, stand in the shower, have a bowel movement in your diaper. I'll come out and I'll change you and reward. But there's no more couch and there's no more chair. Just the bathroom and the shower, right? Reward. And why are you doing that? Slowly breaking that routine, slowly making it more close to what you want the terminal response to be. And then you shape and shape and shape. This is not a quick plan. This is a slow plan, right? Because you're not changing every day. Parents tell me, oh, so then tomorrow I do the shower thing. And I say, no, I said, let him take a week or 2 weeks behind the chair, and then we'll change his world to the shower. And then I'll take the chair and remove, there's no more chair. But let's let him go a couple weeks, right? If I change it too quickly, one day, what might I get? The kid who goes, you know what? No, I'm holding. Right? Constipation, I'm holding. Right? And then it's not a good scene, right? But that slow ritual changing of the ritual works really, really well. But keep in mind, that kid is already toilet trained. He's just toilet trained his way, right? He's not toilet trained the way you want, but he's already trained. So you don't need to do a retraining, right? One last thing I'll say about the training for bowel movements. If it is a skill deficit, a kid who just doesn't know, just didn't generalize. Here's the plan that I tend to use. Keep in mind, you can use other people's plans and everything, but the plan that I tend to use is a rotating 10-minute schedule, starting from when the data tell you the 3 weeks worth of baseline data, when he's most likely to go. I start around that time in the bathroom for 10 minutes, right? And I say, come on, you have to try to go. I usually have a big reward. Bowel movements, you could do big rewards. Urination training, small, quick rewards. But bowel training, because it's only once or twice a day, big rewards. You could go, you want to go to the park? You need to have a bowel movement to go to the park, right? But after you have a bowel movement, we have plenty of time. So we'll go. But you can have a big reward. I had a kid who used to love to watch trains. He used to love to watch subways. And luckily he lived in Brooklyn, in New York. And so for bowel training, that's exactly what we used. They had a subway stop right by their house, like 2 blocks down. He didn't want to ride the trains. He just wanted to see them pulling into the station. It was they just had to go into the station and hang out for 45 minutes. So that's what they did. He would have a bowel movement. They would run down to the trains and they would just stand there for 40 minutes, just watching them pull in and pull out for 40 minutes. For bowel movements, I do recommend, I feel like I'm going to now end on this bad note, but
The next
for
speaker might, get upset.
the next speaker is going to get upset about cut into his time. For bowel movements, I do recommend a punishment for accidents. And I'll tell you why. I don't recommend it for urination training for accidents. I recommend the startle and get them to the toilet. But I do recommend it for bowel training. It's simply a matter of the amount of trials you have per day to teach. You only have 1, maybe 2 trials to teach with. And if the kid had an accident, you taught nothing that day, right? In other words, like if he went in the toilet, you go, good job, we get to go to the trains. 1 trial. 24 hours later, you're trying again. depending on the learning skills of your child, that's 24-hour, one trial a day learning. That's hard for anybody to learn with one trial a day learning, right? Imagine if you were learning how to drive and you made one right turn per day. Like, and 24 hours later, you practiced again on a right turn. And then 24 hours later, you practice again on a right turn. You're not going to learn very quickly, right? You have to keep making right turns in order to learn. Urination training, I can do that. I can get tons of urination per day. Bowel training, I got one to work with. Now, and that's the best case scenario, that he actually goes and gets to get the reward. If on the 10 minutes off, remember it's 10 minutes in, 10 minutes off. On the 10 minutes off, if I turn around and he just went in the living room, no learning that day, I change him and I say, okay, try again tomorrow. And he's like, try again for what? I didn't even perceive training here. I went as I always do, in my underwear in the living room, and you changed me. So you think you're doing a toilet training plan and the kid perceives no change. So you have to do something with that accident. I recommend the punishment-based procedure. So that way the kid, if he goes in the toilet, good reward. But if you go in your pants, something you would rather avoid, right? The punishment's up to you, but I can tell you this, it doesn't have to be aversive and it doesn't have to be harsh. It just has to be something that they would want to avoid, right? So it could be something as simple as, what does your kid hate to do, right? It doesn't have to be aversive. It doesn't have to be like, I'm gonna make it painful in some way. It could simply be, he hates cleaning up toys. Okay, well then I'm gonna make him clean up toys for the next 15 minutes. He hates cleaning up toys. I'm gonna make him clean up toys, right? That it's distracting to speak when two tremendous helicopters pass right by. But so it doesn't have to be. And by the way, when you do a punisher, this is any punishment, toilet training or not, you're not angry, you're not disappointed, you're just a machine. Like, you're just up, you went to the bathroom, now you got to clean up the toys. Like that. I know you don't like it, but you got to clean up the toys now. And once the toys are cleaned up and the punishment is done, and the kid hated it, but once the punishment is done, you don't talk about it anymore. Like, you don't keep bringing it up all day long. Remember what happened when you, like, you don't bring it up. I tell parents, stop bringing it up. Like, he made a mistake. You made him do something he didn't want to do. It's done. Like, then now you move on. Tomorrow, it's going to be up to him to see what he does. Yeah.
Thoughts on the natural consequence of having him clean up the accident?
That is the traditional. So the traditional toilet training punishment is called an overcorrection of the accident. And it's in all the literature. And what you do is you make the child clean up themselves, clean up their clothes, and then overcorrect it. So you might make them wash the floor. Right? They didn't really dirty the floor, but you make them wash the floor anyway. So now you have to go on your hands and knees with a little cloth, and you have to wipe up the whole floor. And it's not a learning procedure. So you're not like nice about it. Like, you're not angry, but it's not like we're going to learn how to wash our clothes experience. This is you messed up your clothes. We have 5 minutes to clean them. And it's not going to be pleasant for either one of us, but we're going to do this job, right? The problem that I have with the overcorrections like that is they tend to get a little messy, and the kid doesn't cooperate, which is good, it's the punishment, but the kid doesn't cooperate. And then it just becomes so much work on the parent to have to now move the kid's arms and move the kid, and the kid is fighting you, and you actually do have feces that you have to clean up. And it's like, okay, this is a punishment for me. This is not even a punishment for him. So sometimes I say, yes, that's in all the literature. It's the natural consequence, and it's in all the literature. But sometimes it just becomes such a chore. It's like having the kid that does an overnight training have to clean their bed of all the urine, and have to wash the sheets and clean. And the parent's like, you know what? It's 2 a.m. This is punishing on me right now. I could get this done in 5 minutes, or we could stay up here for 40 minutes with me prompting my kid to do it. But I would say to use it if it's going to be work for you. Otherwise, you could do any punishment. You could do a response cost. You could throw things out. Now you lost one of your toys. You had a bowel movement. Now I'm going to take one of your action figures that you collect and I'm going to throw it out. You don't really throw it out usually. You like you temporarily remove it. And then, after training is done, it's like, look what I found. I found all your stuff. But you could use a simple punishment like that. But once again, the reason why I advocate for a punishment for bowel training is simply because of the one trial learning. And one trial learning is really difficult. And if they have an accident, you just had a no trial learning day, which is not training. Yeah. Yep.
So my daughter's actually doing great with the important parts. She's consistently going in the potty. It's the finishing the process that's the challenge with us right now. She's 5, doesn't want to wash her hands, doesn't want to flush, and very difficult wiping, ineffective wiping, which I think is partially behavioral and also partially just manual dexterity of doing so properly. I've been trying to do hand over hand modeling to kind of get her used to exactly what she's supposed to be doing for a proper wipe. Do you have any other thoughts or suggestions?
Yeah, oftentimes it's a matter of two. So all those behaviors are behaviors after the fact. They're not connected with toilet training. So the wiping, the hand washing, the flushing, that's all separate behaviors, right? So you can practice them outside of toilet training. So a lot of times the problem with the wiping and not necessarily the hand washing, but the wiping, one of the problems is you have to practice it many more times than a natural going to the bathroom. So I would pull it out of a toileting routine and practice wiping as a program, just as a program. So in other words, you bring her to the toilet and she has to wipe and wipe and wipe and wipe in discrete trials. Right? Hand over hand, prompting, reinforced trials. Good job, that was better. Good job, that was, but literally in blocks of 20. So instead of just one wipe because you went and we have to get the job done, I'm just going to take you to the toilet a couple times a day and we're going to do 20 trials of wiping until you get the physical motion down. I also would maybe take a look at, is there anything physical that you can manipulate to make it easier for her? So in other words, is it the toilet paper that's the problem? Is it the keeping it in her hand without it falling down? Is that because then you could use wipes, or you can use, is it the roll that's the problem? Is it that does she have to stand? Right. So some individuals, it's easier to teach them, listen, you urinate, then it's okay, stand up fully. And then wipe standing. Don't wipe sitting, wipe standing. Because for you, it's easier. So I would maybe look into all those, you probably have already, all the easier ways for maybe her to physically do it.
Also been trying to model on
Yeah.
it all. While that's great, that's a completely different motion. So I've been trying to
The dolls, the reason why the dolls are a problem is exactly that. It's a different motion and a different angle. It's a different vantage point. It's a different angle. It feels different. Yeah. So if it's physical, I would try to maybe see what exactly is the problem with her physically. And when it comes to that motion, and then maybe, is there a way I can make it easier for her and then teach her that? And it might be untraditional. It might be something like, listen, stand up and bend over, but that's okay. You're alone in the bathroom anyway. Just that's how you go. You stand up, you bend over, and you get the job done. And like I said, teaching trials. Don't do it connected with when you pee. Do it, okay, 4 times a day, we take her to the bathroom, we do 20 trials each. Where we practice. Yep.
Quick question on the overnight training. Can it also be reinforcement phase, or is it a different question of the maturation of the bladder for 12 hours, or maturation of something in the brain?
So it's going to be both. It's going to be both. If it's behavioral, like bladder just maturity, it's going to be a behavioral bladder training plan. If it's something called nocturnal polyuria, what happens is we have a hormone arginine vasopressin, that it concentrates our urine overnight. So when we go into a sleep cycle, the hormone, the arginine vasopressin it removes the water from the urine and it puts the water just into your body. And what happens is what fills into the bladder is a concentrated form of urine, right? So that the bladder doesn't fill overnight like it does in the day, right? So some individuals don't have that release of that hormone, right? And then that is actually very easily done medically. It's a supplement called desmopressin. It's typically a nasal spray, but it's not a long-term treatment. It's 100% relapse after stopping desmopressin treatment, but it stops it literally each night. So in other words, like you give the desmopressin as a nasal spray, and it prevents urine that night. But then the next night you have to give the desmopressin again. But it can be used long-term without side effects, except for nasal side effects, like that you might need to use it with like a saline or something like that in order to but there's no long-term side effects with the desmopressin. You can typically figure it out by doing a urination log overnight. And if the urinations are happening towards the beginning of the sleep cycle, it could very well be a nocturnal polyuria. If the urinations are happening towards the beginning of the sleep cycle. If the urinations are happening more in the morning, it's unlikely to be that. But then there are behavioral reinforcement based plans as well. And also what you want to look into is bladder strength. So if you have a urination training problem overnight, strengthening the bladder in the day. So I don't know if he or she is already trained in the day, but doing those things like the interruption of the urine stream trick, do the double voiding procedure, strengthening that bladder could work. Or cutting down daytime urination by half. So she goes, I have to go to the bathroom. You say, sorry, you have to wait. Like you have to hold it. And age also. It used to be 7. We didn't treat overnight training until the age of 7. It wasn't considered, it was just considered maturational up until 7. For whatever reason, in 2013, they reduced it down to 5. So it's now 5-year-old is considered to have enough maturation of the bladder to withstand overnight. But it used to be, so I always tell parents, I don't know what happened in 2013. So anywhere between 5 and 7 is still considered maturational. Yeah, no problem. So that was that talk.
We have our next speaker waiting. So.
We have our next speakers all ready to go. And what time was that talk? 11:45?
We have 5 minutes.
Maybe a break.
5 minutes is good. I don't care. Yeah. I don't need long.
Do we have a padding for her?
Would you like to